In this video, we're going to be talking about emotions. That's our E word for this video. And in managing your emotions as a function of having a chronic disease and a chronic disease called chronic obstructive pulmonary disease, or COPD, or whichever variety in that space that you have been diagnosed with. A chronic disease adds a burden of emotional strain. And it's important that you have support to help. Often, the people around you just don't get it because you don't look sick. Now, maybe you're wearing a cannula and you have your oxygen on, so yeah, okay, now you sort of look sick, but if you don't look sick, people around you may not get it, and they may not be able to support you in your journey. So I want to suggest a couple of strategies or a couple of categories of strategies, and then maybe some strategies within those to help you find the support you need. And I want to also interject here that because you have a chronic disease, quite often, 40% of the time, when you have COPD, you have depression challenges as well. So you've got sort of a double whammy, right? And depression, again, can be one of those diseases that you don't look sick, so people around you may not get it. So here's what I would recommend: that you have an offline support strategy and you have an online support strategy. And when you talk about an offline support strategy, you find a group like Better Breathers Club. That's a program by the American Lung Association. And you can use that strategy where you can get out. They meet once a month, typically for an hour and a half, 2 hours. And there's some education, there's some support, there's connecting with people who are in a similar situation. And then, sometimes there are groups that are not lung association groups, and they have independent support groups for those with lung disease. All right? And so I would say check with your doctor to make sure your doctor is aware, find out whether or not your doctor is aware of any support groups like that. And if not, these days we say Google it, and you would be able to find a breathing support group. Okay? And then, so an online strategy then, if you're very remote and there isn't a Better Breathers Club in your area, then you might use some online support, some virtual support. And a couple I would recommend are, COPD 360. That's certainly a wonderful resource for you to check into. Another one would be mycopdteam.com. That website, very active. And if you're on Facebook, there are Facebook groups that are dedicated to supporting folks with COPD. There are pages also with information, but there are groups there as well. So you have some offline and you have some online. And in addition to those things, there are other strategies that you can use, but those categories of offline and online, then you get some ideas of what you can be looking for. Keep your ears open and eyes peeled, as they say, or is it eyes open and ears peeled? I don't know. But you can be on the lookout for places where you can get support with those, with like-minded and like-experienced people. Now, I always suggest that you ask 3 questions when you think about this strategy. First, what am I doing well in this strategy? And so you might know about a group, right, or know that it exists. All right, so that's one level of what you might be doing well. But then the next question is, what do I need to do to improve? Or how can I improve? And that might be, I might need to attend more regularly or at all. Right, so you know about it, but you're not attending. So that might be one. Another strategy might be, I might need to educate my family more about what my journey is like. Maybe invite them to the support group so they can see what's going on. And the third question I suggest that you ask is that you ask, hey, what system can I put in place? How can I surround myself with a system or a structure or a person to help me improve my outcome when it comes to providing emotional support. You might find that hiring a coach to talk to a couple times a month might be all you need to do, but you might also find that you may need to join certain organizations. You might need to actually get out that computer if you're not very computer friendly, computer literate, get that out so you can get a better outcome when it comes to finding support. So, at the end of the day, as I try to remind you, the end result is that we want you to be able to breathe better so that you can live better.